Hi, I'm Karen Reynolds and my group members are Nur Fitria binti Al-Hamidi, Antonia MDJ, Nur Shamira Eliana binti Kamarul Asmadi, and Esther Jeffrey Jalan. We are from Group 8 and we will present about the case study of lung cancer that we get from the male radiotherapy unit Sarawak General Hospital. This case study is about a 78 years old man that was diagnosed with advanced lung cancer stage 4 in early September 2021. He has other underlying conditions which are hypertension, diabetes mellitus, and dyslipidemia. He was admitted to Hospital Simunjan for medical follow-up, and in early October 2021, he admitted to the same hospital with a complaint of productive cough associated with whitish sputum for 2 weeks. He claims no fever, COVID contact, vomiting, loose stool, and abdominal pain. Swab test or PCR test was being done and laboratory confirmed that this patient is COVID-19 positive stage 4. The patient also developed recurrent pulmonary effusion with underlying lung non-small cell carcinoma. He also was being confirmed for having pneumonia. Next is biographical data. As what I mentioned just now, this man is a 78 years old, a layman, and he worked as a gardener. He married and having 5 children, and he denies any allergies. His chief complaints are abdominal pain since 2020, dizziness, fatigue, drastic weight loss, loss of appetite, prolonged cough associated with whitish sputum, and inconsistent shortness of breath. The presenting symptoms that related to his current illness, which is advanced lung cancer stage 4, are shortness of breath, hemoptysis, chest pain, and chronic cough presented with whitish sputum. Next, I will pass the slide to Nur Fitria.
Good day to the examiners and my colleagues. My name is Nafitra binti Al-Hamidi and my matric number is 70951. Today I will present about the past health history, assessment and the result of clinical examination. About the past health history, this patient has a set of underlying conditions, which are hypertension, dyslipidemia, diabetes mellitus, and right lower lobe lung mass. Patient presented with chronic cough associated with whitish sputum since June 2021 and was diagnosed with advanced lung carcinoma 3 months after. Chest X-ray was done and showed right epithelial to lower zone consolidation. Fluoroscopy showed thickening by this plaque. This patient was an ex-smoker for 30 years and denied any alcohol consumption. He stopped working since 2020 and as he experienced abdominal pain, dizziness and chest pain for a few months. Patient experienced loss of appetite and weight loss. His weight was drastically decreased from 60 kg to 50 kg within 1 month. Then we move to the assessment. Most of the time we can see that patient is lethargic and paralyzed. During we do the observation or nursing care to the patient, we can see that patient most of the time tachypnea. In the blood pressure, always tachycardia. The patient also develop weakness on both sides of lower and upper limbs. He barely move freely on his bed, and capillary refill time more than 2 seconds. PT edema 2 plus on both sides of lower limb, abdominal tenderness with palpation, adventitious breath sound, crackles, detected during auscultation of right lungs. And we can hear that wheezing sound during even when the patient using the venturi mask or high flow mask. Result of the clinical examination: chest X-ray, haziness over right lower zone detected. Creatinine serum level 57, lower than normal level, which 62 to 106. Albumin 30, lower than 35, which means the normal range is 35 to 52. Alkaline phosphate more than normal range 164, which the normal range is 40 to 129. Inorganic phosphorus is 1.53 millimole per liter, which more than 0.81 to 1.45. WBC normal 7.5, while RBC is slightly lower than normal range 4.38, while the normal range is 4.5 to 5.5. Hemoglobin lower than normal range 11.7 due to hemoptysis. The normal range of hemoglobin is 13 to 70. Both of these is the chest X-ray of the patient. This one is before the pleural effusion developed. We can see that the haziness on the right lung. Here we can see that the patient developed pleural effusion after a few months. Okay, that's all from me.
Thank you for the presentation. My name is Nur Shamira. I'm going to present about the pathophysiology and management of lung cancer. This patient was extreme smoker for years and living near construction causes air pollution. Chemical from these factors bind with the NS cell, then damage the cell slowly. As time passed, it changed the cellular structure and abnormal cell growth. This led to lung cancer. This patient was diagnosed with stage 4 non-small lung carcinoma, which the most advanced stage of this disease, which can refer to any type and size, either adenocarcinoma, squamous cell carcinoma, and also large cell carcinoma that could be spread to other part of the body. Next, for pharmacology treatment, patients were on tablet cardioprin and also paracetamol for his pain management. Besides, medications such as tablet amlodipine, which to treat high blood pressure, and also simvastatin to lower the level of cholesterol, also were administered to the patients. Moreover, tablet calcium carbonate also administered to this patient to increase his calcium level. Oxygen were administered to supply adequate oxygen level needed by the patient. Next, palliative care such as non-pharmacological pain management, anxiety management, nutrition, diet and plan, coping and support from the family, friends and counselor were planned for this patient. Next, I want to explain why this patient not undergo chemotherapy, neither radiotherapy. This is because this patient were late diagnosed and received treatment. Besides, the patient also refused to receive this treatment. Due to impairment of general condition, chemotherapy also cannot to give due to its toxicity. The spread of cancer to other part of the body became no benefits of the treatment, but risking the patient. Lastly, the doctor and other physicians also estimate life expectancy for this patient only for 3 to 6 months.
Hello, good day, sir. I'm Esther Jeffrey Jalan and my matric number 68219. I will continue this presentation with nursing care plan. Our nursing diagnosis for this case study is ineffective airway clearance related to increased tick secretion, secondary to pneumonia as evidenced by shortness of breath, respiratory rate 26 per minute, SpO2 85 to 87%, and chronic cough presented with whitish sputum. Our goal is patient will maintain the pattern airway, SpO2 more than 95%, respiratory rate 12 to 20 breath per minute, and he can demonstrate effective way to remove the secretion. Our nursing intervention to assess patient's vital signs, respiration rate, and SpO2 level, it is as a baseline data and to determine the next intervention that needs to be done. Second, we will position patient in fullest position. It will maximize lung expansion and promotes better oxygenations. The third one, administer nebulizer treatment such as salbutamol as prescribed by the physician. It will promote relaxation of airway smooth muscle, widen the airway and making it easier for the patient to breathe. 4. We educate patient on coughing exercise. It will enable patient to perform proper technique to keep the airway clear of secretions. 5. To instruct patient to increase fluid intake if not contraindicated, because the water will help to dilute and loosen the excessive thick secretion so that patient will be able to cough it out easily. And lastly, we will perform suctioning to remove the secretion and inform the physician immediately if the patient's condition deteriorates. The suctionings clear up the mucus, build up and promotes the proper breathing. So our nursing outcome, the patient was able to maintain patent airway with SpO2 level at 98%, respiratory rate of 20 breaths per minute, and patient performed effective way to remove the secretion. That's all my part, and I'll pass this presentation to Miss Antonia. Thank you.
Hello everyone, my name is Antonia Abijek and I will be proceeding with the next nursing diagnosis, which is ineffective breathing pattern related to shortness of breath secondary to the progression of lung carcinoma stage 4 as evidenced by respiration rate of 26 breaths per minute, labored breathing and the use of accessory muscle. The goal for this care plan is patient will be able to maintain an effective breathing pattern with respiration rate within the normal range, which is 12 to 20 breaths per minute. The first intervention would be to assess patient's respiration rate and depth. This is to obtain baseline data and to detect any abnormality that indicates any deterioration of patient's breathing pattern. The next one would be to place patients in Fowler's position, which is 45° to 90°, to allow maximum lung expansion and to promote better oxygenation. The third one would be to administer oxygen through venturi mask according to doctor's order. For this particular case, venturi mask was used to administer oxygen at 15 liters per minute. This is to supply enough oxygen to the patient. The next one would be to stay with patient during acute episodes of respiratory distress and to reassure patient to stay calm. This is to promote relaxation and reduce anxiety, thus allowing normal breathing pattern. The last one would be to educate patient and caretaker on how to perform proper breathing and coughing techniques. Proper breathing techniques is important to promote lung expansion and maximize gases exchange. And for coughing techniques, it is important for patient to be able to perform coughing techniques because it is important for the patient to get rid of the thick secretion and to allow better breathing pattern. The nursing outcome for this diagnosis is patient was able to maintain an effective breathing pattern with respiration rate within the normal range, which is 20 breaths per minute. The last diagnosis would be altered comfort related to pain secondary to respiratory distress as evidenced by restlessness, rapid breathing, and chest pain with pain score rated 5 on a rating scale of 0 to 10 as verbalized by the patient. The goal for this care plan is patient will be able to describe satisfactory pain control at level less than 2 on a rating scale of 0 to 10. The first nursing intervention is assessing pain score for the patient and factors that cause the pain. It is important for us to obtain the baseline data so that we can decide on pain management that needs to be done next in order to raise the level of comfort for the patient. The next one would be to make some environmental changes such as reducing noise and adjusting the light, whether by making it dimmer or brighter according to patient's preferences. This is to promote relaxation and reducing stimuli that may induce stress to the patient, which eventually will increase the level of discomfort of the patient. The third nursing intervention would be to provide reassurance by explaining any procedure that will be done to the patient and to tell patient to remain calm. By explaining the procedure prior to the application of the procedure to the patient, this will decrease the level of anxiety of patient and eventually will lower the level of discomfort that the patient is experiencing. The fourth one would be to educate patient on relaxation techniques such as deep breathing exercise. Deep breathing exercise is important because it will help in oxygenating the body properly, improving focus, and eventually will increase the calmness and relaxation for the patient. The last intervention for altered comfort would be to administer analgesic as prescribed by the physician. Analgesic is important as it will help in inhibiting the sensation of pain by blocking the production of prostaglandin, which is a group of lipids that play an important role in generating inflammatory response because they will develop the signs of acute inflammation for the patient. This is the outcome for this care plan, which is patient was able to describe satisfactory pain control at level 1 on a rating scale of 0 to 10. This is our list of references, and that's all for our presentation. Thank you so much and have a nice day.